Clark County has grown so much in the last few years, but there's still a lot we could do to make it an even better place to live. Hi, I'm your host, Wendy Rush, and we're not here to talk about problems. Our community is a family. We're all in this together. That's why we are Talking Solutions. Hi, welcome to the show. Topic of the day is bleeding disorders, what they are, how common, possible signs, treatments, and resources here in Las Vegas. And we have two guests on the phone. First of all, dealing with these bleeding disorders on the clinical side, we have Director of the Bleeding and Clotting Clinic at Cure for the Kids Foundation, Dr. Aimee Foord. Dr. Foord, welcome to the show.
Thank you so much for having me.
Very grateful for you to be here, lending your expertise on the subject of bleeding disorders. We will start with asking you some questions about the clinic and bleeding disorders themselves. And later, we're going to speak with someone who has recently been diagnosed with a bleeding disorder after her 5-year-old was also diagnosed. She's going to share her story in a little bit. Shawntel Ringler, welcome.
Thank you for having me.
Very happy to have you. So we'll start with questions with Dr. Foord. How long have you been with the Cure for the Kids Foundation, and how common are bleeding disorders?
Thank you again for having me. So I started at Cure for the Kids just over a year ago now. My medical training has taken me all over the country. My focus has always, and my specialty has always been on benign bleeding and clotting disorders, as well as abnormal hemoglobins like sickle cell disease. And so Las Vegas has a very big need for pediatric subspecialists. And so I moved down here last year, and I have really enjoyed building my practice.
Well, and welcome to Las Vegas. You said you deal with some bleeding disorders that are benign. That makes me wonder, are there a lot of people who have a bleeding disorder and don't realize it? And what are the possible signs and symptoms people should be looking out for?
Yes, that is quite an interesting question, and I think our patient will talk about that a little bit as well. So signs and symptoms of bleeding disorders can happen to anyone, really, and they can be normal sometimes, but sometimes they are from a bleeding disorder. So those include things like nosebleeds, bleeding after surgery, bleeding for a longer time from a cut or a scratch, or easy bruising, as well as in females, heavy periods. I think for the most part, most of us grew up thinking that heavy periods was just unlucky or a part of life, or maybe genetics. But actually, it could be genetics that are a bleeding disorder causing your bleeding condition.
Wow. So I would guess that you would recommend anyone who does have that to get checked out.
Yes. Your regular physician can do a limited screen for bleeding disorders quite easily. But if you have any abnormalities in those labs, or if you have any concerns for bleeding symptoms, we're happy to see you.
Perfect. Thank you. And the bleeding disorders that you mentioned, you said bruising easily. Do people with these bleeding disorders have an increased chance for internal bleeding after a fall or an accident?
That's a good question as well. And the best way to answer it is it depends on what disorder you have. So when you start bleeding or get a cut or a scratch, there are multiple things in your body that go to help heal that cut or scratch. And one of the reasons why I love my job is trying to figure out what piece of that puzzle is missing, or which piece is defective, because each piece has a very important role. Each piece is treated a little bit differently, and each piece has different risks along to it. So it really depends on the patient. Each patient is treated individually with bleeding disorders. One treatment protocol may work great for one patient, but not work for another.
Thank you, Dr. Foord. And you just said something that piqued my interest. You said that part of the passion is to figure out which disorder someone has. Off the top of your head, how many would you say there are?
So, and Shawtel, our patient, will talk about this a little bit, but the most common bleeding disorder by far is von Willebrand's disease. And it affects 1 out of 100 people. And there's like over 2 million, I think 2.5 million people in the U.S. with von Willebrand.
Oh my goodness. So much more common than people probably think.
Yes. In addition, it's very common that we diagnose the way that Shawntel was diagnosed nowadays, because we're better at screening. We're better at medicine in general. We're better at asking questions. And so I do have quite a few parents that are diagnosed after their child is diagnosed, because most of these bleeding disorders are genetic. There are some that are not genetic and are caused by other things, But von Willebrand's, the most common, is definitely genetic.
Wow. And we will get to that. That is the case for Shawntel. And I can't wait to speak to you because I'm sure you're going to pique a lot of people's interest who might be in the same situation. But before we get to that, Dr. Foord, so once the bleeding disorder is diagnosed, how is it treated? Is it medication or surgery? What's the process?
So like I said, treatment is based on what you're missing or what is defective. So speaking about von Willebrand's, there's different steps or different components of treatment depending on what your bleeding symptoms are. There are medicines you can take by mouth at home to help nosebleeds. There are medicines to take at home to help your period. In addition, there are birth controls that you can take that help lighten your period and regulate your period. But also, there might be harder to control bleeding, or maybe your period isn't just controlled with oral medicines at home. And that's when we get into the IV medicines that we can give. We have an infusion center at C4K's, so a lot of our bleeding disorder patients present for infusions before they have dental work or before they have surgery, and they get their factor or their infusion prior to the surgery, and then they go to their surgery center, and then they come to us daily to make sure they're not having complications or bleeding. Sometimes our patients do have to be admitted for their surgeries a little bit longer to receive multiple infusions, but there's different ways to treat each different one, and we try to find what works best for what the patient needs and allow them to live their life. Wow. Regardless of having a bleeding disorder.
Yeah, thank you, Dr. Foord. So now the Bleeding and Clotting Clinic is where you work inside C4K's Foundation. And this is one of the few places here in the state of Nevada that offers this kind of specialized care for those with bleeding disorders. And while you are board certified in pediatric hematology and oncology, it should be made known that because this is a genetic disorder, as we will see with Shawntel's experience, that this is a lifelong condition. So you treat not just children, but patients of all ages.
That is correct. And I think most pediatric hematologists have come to realize that there's just a need to follow these patients into adulthood because there's not a lot of adult benign hematologists. There's a lot of adult oncologists, but the ones that focus on bleeding disorders are harder to find, and especially in southern Nevada, it's very hard to find. And so we're here to help, and I'm very upfront with my patients telling them that I'm not an adult physician, and I do need them to continue following with their primary care provider to help treat and to test for other comorbidities that come with growing up and becoming an adult. But your bleeding disorder is for life, typically, if you have something like von Willebrand's or hemophilia. There are some bleeding disorders that are autoimmune and can resolve over time, but the ones that are genetic and from birth, they don't change throughout your life. And so we are willing to see from peds through adults.
Wow, thank you. So over there at the clinic, you have something called a comprehensive clinic that you suggest every one of your patients participate in annually. What is included in that, and why would you say it's so important for your patients to engage in it?
So studies have shown that patients with complicated diseases that can affect multiple parts of your life. Studies have shown that if you have comprehensive care, those patients have a better outlook on life and they do better in their disease itself. It improves every aspect of their lives. And although I spend a lot of time with my patients, sometimes there's other parts of my team that ask a question a little bit differently or go a little deeper or focus on something else where they find out other information that I was like, oh, wow, I didn't ask that, or we didn't talk about that. And so comprehensive care really makes sure that the bleeding disorder doesn't affect any part of the patient's life. So for kids and adults, they're seen by myself as the provider, but they also have labs taken by our phlebotomist. We have a lab as well that can draw basic lab studies. And then you're also seen by our nurse coordinator to make sure that, and she runs through a bleeding flow sheet to see how your bleeding symptoms are controlled. Then you see our physical therapist who makes sure that bleeding isn't affecting any of your joints or bones. You see our social worker who helps to make sure you have all the support you need, because patients with bleeding disorders can need medicines at school, so they need special notes for school. They might have to miss a couple days for school if they have bleeding or if they have to go into the hospital. They might, and then a lot of patients with bleeding disorders don't know, but they qualify for special scholarships too, and so our social worker helps with all of those. We have a nurse practitioner that helps with holistic and alternative care to focus on other ways of handling joint pain or bleeding that isn't just medications. We have our pharmacist that goes over all of the refills that they need and make sure that they're giving the medicine and storing the medicine in the correct way. And then I'm the last person that goes in. So it's a long visit. We do try to be respectful of the patient's time, and that's why it's just once a year. But if the patient need us in between, they can see just me, or they can reach out to any of those providers and see them more frequently than once a year. But the once a year comprehensive visit is to make sure they're plugged into every support system that we have if needed.
When you were explaining that, you said you spend a lot of time with your patients, and I know you've been doing this for a long time. So in your history, what would you say are the most common problems that you've seen your patients with bleeding disorders encounter?
So I think a lot of them encounter nosebleeds, and I had talked about the oral medications that they can take at home, but there also is nasal sprays that they can use to help prevent nosebleeds. And then for genetic ones, as well as some autoimmune bleeding disorders that are more common in toddlers, I think it's just hard for families in general to understand that a patient is at risk for bleeding, but we still have to let them be a toddler. And so it's very hard to keep a toddler to sit still and to not bump into tables or chairs and stuff. And so it's scary. And then they grow up and they go on playgrounds and they're on monkey bars and falling and slides and stuff. So I think because the majority of my patients are pediatric, I think a lot of them get bumps and bruises, and then the decision is whether they need further care or whether it's okay to watch at home. And as kids grow up, parents get more knowledgeable, and we really trust in parents and caregivers' instinct. If something is wrong, we are happy to see them. We are happy to have them evaluated in the ER if needed to get imaging. And our clinic has physicians on call 24/7 on weekends and on holidays. Some of our patients are always worried about calling in evenings or weekends, but we are here to help our patients.
You mentioned nosebleeds being the most common, and that made me think, does this affect other medical procedures like a dental visit?
So one of the reasons a lot of patients see us is because of a family history of a possible bleeding disorder or because of abnormal labs that were checked before a procedure. And so it is very important to know whether you have a bleeding disorder before you have an invasive procedure so we can prevent any bleeding. So a lot of our patients come to us for clearance for dental work or clearance for a tonsillectomy sort of thing, and we help them through that because they need the surgery or they need the dental work. And so like I had said before, each patient has their own bleeding plan, and even though some people have the same disease, their bleeding plans might be different because different medicines work for them or different doses of medicines are needed to treat their personal bleeding, and then the doses are also and the medicines we recommend are dependent on how invasive the surgery is.
Thank you so much, Dr. Foord. I appreciate all your expertise in this. And Shawntel, I'm so excited to talk to you, and thank you so much for being so patient. You're still there, right?
Yes, I am.
Okay,
Thank you for having me.
Of course. So Shawntel, I'm very interested to hear your story. This is a genetic disorder you found out after your daughter was diagnosed. Tell us about how that happened.
So when my daughter was about 1 year old, I talked to her doctor and I'm like, hey, she's bruising a lot. I'm like, it doesn't feel right. You have that mother instinct. And I was told she was fine. Nothing was wrong. And then I ended up moving a year later, found a new pediatrician. And the pediatrician told me that we can run some labs. If it's abnormal, we can treat it. If not, at least we have reassurance. So we did the labs and they were obviously abnormal. So we took her in to the Care for the Kids clinic and she got her diagnosis. And then after that, my insurance required a referral for me. So I went to my primary care doctor and I asked to be tested because of my complications from my history. And my labs came back as normal. abnormal as well. So then we both kind of started going together because going together kind of seems easier on her. And then, ever since then, we've just been getting treatment and going with the flow.
I have a 7-year-old, so I my heart goes out to you thinking how much I worry about my little girl. And as Dr. Foord said before, on the playground, and your little girl is about 5. So how does this bleeding disorder affect her in her everyday life? And do you have those, where do you worry the most? The playground is the first thing that comes to my mind. Like, how does that affect you?
So when she first started school, I would be stressing out every single day. Her teacher would message me over every bruise, every bump. And over time, I just kind of got calm about it. As we learn more, we just learn to handle it. We don't want to show our kids that we're stressing out because then they get worried.
Sure.
So I try to look up and be positive and be thankful that we do have the medical team that we do to help us when I need it. But the only time I really stress out and get worried is when we have a serious fall, which I do get notified because the school is overprotective of her. But I try to let her be a kid. I don't want her to grow up in a bubble and just kind of isolated from other kids. So I want her to experience everything that a child without a bleeding disorder does, because if she does get hurt, I know we have the whole medical team to back her up.
Yeah. And I'm going back to what you said about your doctor, the first doctor that you took your daughter to and said everything was fine. This is just another testament to the general public, and even some medical staff don't have a vast understanding of bleeding disorders. And tell me about what recently happened when you tried to go to your dentist.
So I went to my dentist because I cracked a tooth. I figured, I'll go in and I'll do what they have to do. I've never had a problem before, but something didn't sit right. And I was like, I'm still recently diagnosed. So I told them, I'm like, hey, I just felt I should let you know I do have von Willebrand disease. And I had to tell 3 nurses and then the dentist, because it needed to be surgically removed since it cracked through the gum. And the dentist comes in and he goes, let me go look into it, because it's not very common. Not a lot of doctors know what it is. And then he came back and he told me that I had to go to an oral surgeon. And I wasn't expecting it, and I was pretty upset. But now that, I'm past it, I'm actually really grateful that he did that.
Yeah, I would imagine so. And a quick bounce over to Dr. Foord. Do you find that it's normal that a general dentist would not know what to do if there was excessive bleeding during one of these procedures?
So I think dentists rely on patients a lot to tell them if they have an underlying bleeding disorder before they do anything. But I think it's a lot, the patient has to know to be their own advocate for, like, if they have a diagnosis. If they don't know they have a bleeding disorder and they have dental work, typically the bleeding is more prolonged and oozing that can't be controlled. And the problem is that in a clinic you don't have a lot of resources that the ERs do with medicines and stuff. And so I'm certain that if any procedure had unexplained or unexpected bleeding from an outpatient office, they would send to the ER. The thing with oral surgeons is they typically do procedures in surgery centers or in the hospital itself in the OR, and so they have more access to medications and transfusions and other things to help stop the bleeding.
Thank you, Dr. Foord. So, Shawntel, you said before that you took your daughter in to eventually get this diagnosis because one of the things you said, she was bruising easily, but only that led to you getting tested. Did you not notice in you, or do you not have these typical symptoms of a bleeding disorder like bruising easily?
Actually, I have the symptoms worse than my daughter, but I grew up that I never went to a pediatrician. My dad never took us to doctors. We never talked about medical history, nothing like that. The only time my father actually took me to the doctor was when I got seriously hurt. And as a kid, I didn't think of, hey, I'm bleeding a lot, or, this isn't right. My dad, took care of us. So, but as I'm older, I realized it wasn't normal.
Sure.
Not to interrupt.
You're fine, Dr. Foord. Go ahead.
It's actually quite interesting to me as a physician that Shawntel's labs are quite impressively low, because in von Willebrand's disease, as we get older, our levels increase regardless whether you have the disease or you don't. Everybody's von Willebrand factors go up a little bit with age. And so there are a lot of parents that have had symptoms, but when they're tested as an adult, their levels are now normal, but just above normal. And so some of them are told, oh, you don't have it. And so when they bring their kid to me, they're like, but we were tested and we're negative. But studies have shown that if you were ever diagnosed with low levels in your childhood, even as you age and your levels go up, they won't reach the same levels as somebody who never had bleeding symptoms or they never had low levels ever. And even if they do reach normal levels, those adult patients still have the same, they still have bleeding risk. They still have increased bleeding compared to the normal population.
Thank you, Dr. Foord. And forgive this if this is an ignorant question, but you keep saying the word levels. What are these exactly measuring?
Yes. So the bleeding and clotting in your body is very complicated, and it is like a puzzle, but you have different things that can be low or defective. So in von Willebrand's disease, we test your von Willebrand factor level, but we also test your von Willebrand factor activity. In addition, you have different sizes of von Willebrand proteins in your body, and so we test each of those different, they're called multimers. And von Willebrand's has a job of protecting one of your coagulation factors. It protects your factor VIII, so we actually do that as well as part of the von Willebrand profile. But you have other things in your body that helps you stop bleeding. So you have your platelets and your other coagulation factors, which are factor 1 through 12. And those are tested other ways. You have a factor 13, and then we have enzymes that don't want our body to clot too much. So we have enzymes that break down our clot. So if those enzymes are too active, that could lead to bleeding too. So really, you can imagine in your head with a bunch of puzzle pieces that this clotting cascade is quite intricate and quite complicated.
Yeah,
and it's hard to find a defect, but knowing when you have the symptoms, knowing that those aren't normal, knowing that a heavy period shouldn't keep you from going to school. You shouldn't have to use the super heavy pads all the time. You shouldn't have to change your pad every half hour. Those are all different. Knowing that nosebleeds shouldn't last more than 5 minutes. Knowing that we will continue to look until, and whether we find a more common bleeding disorder or a rare bleeding disorder, I'll keep looking until we find something.
Wow. Great information. Thank you so much, Dr. Foord. One more question for you, Shawntel, before we wrap up. First of all, can I ask your age?
I'm 29.
29. So at the young age of 29, you were recently diagnosed with von Willebrand disease, but up until then, went your whole life without realizing you had it. Is there anything that you would like people to know about people like you who have a bleeding disorder?
We are normal people. I know my daughter, she gets treated differently because people are so scared to hurt her, but she still has feelings. She still, we have a medical team for a reason. I just wish more people would treat her like the child she is, because it's never fun to grow up and be excluded, because that's how she feels. And now she likes to go around and lie and tell people she doesn't have a bleeding disorder, and I've had to correct her several times, but it's just the fact she just wants to fit in with other kids.
Wow, that must be tough. Thank you so much for sharing that, Shawntel. A very important message. Dr. Foord, any final thought before we wrap up?
I really appreciate the time and being able to talk about this, and going off of what Shawntel said too, my goal as a pediatric hematologist is to let the kids be kids and let them do the activities. Now, some activities are a little harder for me to allow than others, but we have patients with bleeding disorders that are in the MMA. We have patients with bleeding disorders that have played college football, and just finding the individual treatment plan is our goal.
Thank you so much, ladies, for your time. Very much appreciate this. And it's great to see this, living with this disorder, and also from the clinical side, treating people with it. So I appreciate both your time. Dr. Aimee Foord, Director of the Bleeding and Clotting Clinic at Cure for the Kids Foundation. Get information at cure4thekids.org. And Shawntel Ringler, a patient just recently diagnosed with a bleeding disorder, kind enough to come on the show and share her story. Both of you ladies, thank you so much for your time.
Thank you for having us.
Talking Solutions is a production of Beasley Media Group. For a podcast of this show and related links, visit the Talking Solutions page at kdwn.com.